So today we will discuss about drug of choice, antiepileptic of choice in different type of seizure disorder. Generalized tonic-clonic seizure, focal seizure, typical absent seizure, and atypical absent or myoclonic or atonic seizures. The drug of choice. First line drug. To remember this, we have a very good mnemonic. So remember this. This is lava. So we know lava is very much dangerous. It is generally damage over the large area, and it is also very much dangerous. So like GTCS, very severe and dangerous and generalized thing. Number one story. Number two story is, now college students are absent on Monday. So they are typically absent on Monday due to they are taking ethanol on Sunday. So they typically they are following the typical pattern. They are either absent in Saturday or they are absent in Monday, as they are taking alcohol on Sunday or sometimes in Saturday. So they are typically absent. So they are taking due to ethanol. Now some atypical absent, they means they are making planning like neta use topi. Okay, so some students, they are atypical absent because their pattern of taking leave is not similar. They are taking sometime in the mid of the week, sometime taking Wednesday, sometime in Thursday. So these are atypical, same like making plan. So number three story is, there is a local problem, local issue. So local crops means body, local body is maintaining these things, local army is managing these things. So local issue, focal issue. So local or focal issue is solved by local crops. So crops means I am telling as COP. So for GTCS, drug of choice is, yes, LA for lamotrigine and VA for valproate. Now absence seizure, for typical absence seizure, they are taking ethanol, ETH lava means ethosuximide, and La for lamotrigine and Va for valproic acid. Now for atypical absence, they are like neta type, so they use topi lava. Topi means topiramate, LA for lamotrigine, VA for valproic acid. Now local crops, solving the local problem or focal problem by vocal. So L2, one L for lamotrigine, another L for levetiracetam, C for carbamazepine, O for oxcarba, P for phenytoin. So let's look it. So for GTCS, already told, lava, lamotrigine and valproic acid. For focal seizure, L2COP COP, lamotrigine, levetiracetam, carbamazepine and oxcarba, P for phenytoin. For typical absence, ETH lava, that is ethanol lava, ethosuximide, La for lamotrigine, VA for valproic acid. And for atypical absence or myoclonic or atonic, these are neta type, topi lava. So topiramate, La for lamotrigine, Va for valproic acid. That's it.